Good evening, everyone, and thank you for taking time to join us tonight. Tonight, we are going to be discussing periodontal health, treatment planning strategies for combating periodontal disease in your practice. And in this webinar, 1-hour webinar, we are going to go over several objectives. Periodontal disease, I'm going to go over the background, the prevalence, the systemic connection. I'm going to talk to you about in-office products that I use and methods that I use for my patients, at-home methods for treating periodontal disease. I'm going to talk to you about tools for positive case acceptance, improve your patient communication to get patients on board, and increase their home care maintenance. The periodontal disease, we're going to go over the background, like I said before, the prevalence, and the oral systemic connection. In your practice, in my hygiene practice, we have a consistent protocol that we use for managing our patients from our very first phone call, through our exam, through our diagnosis, through the patient's home care behavior. We try to modify their behavior if we need to. We treat everything in our practice. We have the latest technologies in our practice. And I have learned this in my 27 years to go ahead and just kind of, and I'm going to use this term a lot. That's what my practice is. I think outside the box for dentistry, always. And so that's how I treat every service that I offer in my practice, including perio. We're talking about soft tissue management. Because if you look in your own practice, tomorrow when you go into your practice, 3 out of every 4 patients that you see, are adults, have some form of periodontal disease. Whether it's bleeding, whether it's a few pockets, when you measure the pockets, whatever it is, whether it's bad breath, patients in your practice have this and they need you to identify this and let them know they're at risk. And so you can start in your own practice. And if you're not offering this service, I hope after tonight's webinar that you will be excited about this and will offer it. What is periodontal disease? People call it gum disease. It's just like people refer to a crown as a cap. Everybody has different names for things in dentistry. Periodontal disease is a chronic infection of the gums, of the periodontal tissue. So you need to inform your patients that it is an infection and it's an ongoing infection and there's something that needs to be done. And there are different levels of the disease, ranging from mild gingivitis. And if we don't take care of the mild gingivitis, that's going to lead to periodontitis or severe. So we need to educate our patients and let them know. And what it's caused by is anaerobic bacteria that's in the mouth and that it gets out of control. And it either gets out of control from lack of home care or the health history of the patient. We have to take all this into consideration. And you got to remember that anaerobic bacteria is the bacteria that thrives in the absence of oxygen. So oxygen is the only enemy of this bacteria. So when the bacteria gets down into the gum area, into the pockets, you can't get it out unless you use some kind of products or the root planing, things like that. And I'll discuss this because once it's developed, brushing and flossing will not eliminate the problem. You've got to educate your patients and let them know that due to a combination of treatment, including medicines, home care, plus coming into your office is going to eliminate the disease. And if you look at your patients and if you look at the literature, 75% of US adults have some form of periodontal disease. And there are different stages of periodontal disease. And it's good to have charts. I have laminated teeth, so I can show my patients. The hygienist shows it, and then I just reiterate what they've already talked to the patients about. And it works very well in our practice. Gingivitis, bleeding of the gums. We take a lot of oral photos in our practice. And I tell you what, they say that a photo says 1,000 words. Well, it does. And if you look at a patient's mouth and the gums are inflamed, if they appear red, swollen, you need to take a photo of that and show the patient that. The tissue begins to separate and recede from the teeth. That's periodontitis. And it causes deep pockets. And this allows the plaque to move towards the root surface and the periodontal ligament and towards the bone. And that begins severe. And so the tissue that supports the tooth structure and bone is destroyed. And then people begin to lose teeth. So you need to educate patients. You don't want to lose teeth. I had a patient that came in today and they have an upper denture and a lower partial. And, I told her, I said, we want you to hang on to the rest of these teeth. We need to do something to help you. And she listened to me and she became a patient and she became a believer in what I'm telling her because I educated her and I took a few minutes to talk to her about this. you need to explain to them what deep pockets are. And no one should ever want deep pockets, not these deep pockets. We want deep pockets with other things, but not with perio. So it usually starts with poor oral hygiene, bad brushing habits, not flossing. And I see patients all day long, but I have started, and my hygienists have started this too over the last probably 10 years. I want to see the patient floss. I want to see how they floss, because we all know only 20% of the population say that they floss regularly and effectively. And most of these people are not telling us the truth. So we want to see how they floss. I'll say, here's a piece of floss, show me what you do. And then they fumble. They don't know what to do because they don't floss. They wrap it around their fingers and they try to get in there. We hand them a mirror and they still don't know what to do because they're not really taught how to do this. So we do oral hygiene instructions and we talk to them about poor oral hygiene and what it leads to and how it can have uncontrolled bacteria growth in your mouth, which leads to periodontal pockets. So anaerobic bacteria forms plaque in the pockets, and then plaque colonizes and forms biofilm. The biofilm takes over, and then severe deep pockets form. Your tissue's destroyed, you eventually have bone loss and tooth loss, and everything's destroyed, and it's hard to build it back up, especially if you're trying to, like I place implants in my practice. So when you try to place implants, there's no bone. So it's just a road to destruction if we don't educate our patients and let them know what we need and what we expect and what they can do through home care and through in-office care that we provide. How fast does biofilm form after scaling? And this is a great cycle to show your patients and explain to them what happens, because immediately after a scaling, pedicle formation happens. Then within 3 hours, bacterial attachment occurs. Within 6 hours, bacteria begins to form plaque above the gum line. And a lot of times when patients come in and they have plaque, we take photos of it. I mean, in the first thing in the morning when you come in, you should not have plaque on your teeth. So we take photos of it, and in a very, we use certain verbiage because you got to be careful. You don't want to hurt anyone's feelings, but you do want to educate the patients. We explain to them about plaque. With 7 days, the plaque colonizes and matures above the gum line. And within 3 to 12 weeks, it attaches to the tooth surface or the epithelial tissue below the gum line, and it starts to form what we call perio pockets. It's a bad cycle for the patient, but the patient needs to understand what's going on with their cycle. And one thing that I have in my practice, what's changed my practice, and I'll talk to this in a few slides, you'll see this, is your mouth is the gateway to your health. So when you look at patients now, you need to look at them different. You need to look at their health history, see what's going on. If you look at their mouth, and then you go to health history, you're going to know what to expect on their health history. You are going to see heart disease. You're going to see oral cancer. You're going to see respiratory infections. You're going to see dementia. You're going to see uncontrolled diabetes. You're going to see these things, pulmonary disease, joint replacement. You're going to see all kinds of medications, xerostomia. You're going to see this, and that's why it's so important for us as health givers to look at their medical history, look at it, explain to the patient what happens in their mouth affects everything else, especially patients that are going into surgery, patients that have cancer. Everything kind of evolves around it, your body and your health. Periodontal disease and heart disease. Studies have found that people who have periodontal disease are twice as likely to also have coronary artery disease than those who do not have gum disease. That is found in your patient's mouth that have periodontal disease has been found in these arteries for patients with heart disease. And if you look at the diagram, see the artery wall, there's a clear artery. And then if you look at the artery with a plaque buildup, that's the same bacteria that's found in your mouth of patients that have perio disease. So you need to look at that. You need to educate patients. Patients with gum disease were 2.63 times more likely to have a stroke than those without gum disease. So we need to talk to our patients about this. Talk to, your cardiologist about it. Make a visit. Make sure that everybody's on the same page. There's documented risk factors linking periodontal disease and pregnancy. People that are pregnant, all their bacteria changes. Patients bleed. Patients have everything going on in their mouth. Their tissue gets inflamed. And we need to educate women that are pregnant with their home care, what they need to do to increase it. Of course, a lot of these products, you have to be careful when a patient's pregnant. So you have to take care of that, just like we do all our other patients. We have to look at their history, see what's going on. But they do need help with their home care because scientists from Case Western University link bacteria from my mother's gums to an infection in a baby that was stillborn at a full-term pregnancy. So it's indicated that women with period disease may be at risk of adverse pregnancy outcomes, such as giving birth to premature babies, low birth weight babies. So you need to let your patients know, be excited about their pregnancy announcement, let them know, but also let them know that during these 40 weeks, they need to take extra care of their teeth. Diabetes. It's a two-way street with diabetes and periodontal disease. Adults with diabetes have 4 times the alveolar loss, bone loss from periodontal disease as those who don't have diabetes. And you can look at a patient and tell once they open their mouth, you can see so many diseases. I can see heart disease when I look at a patient with the bleeding gums. I can see a patient that's a diabetic, a patient that has a liver problem. Once you learn this and once you learn how to examine the oral cavity and look for these, you'll be able to identify so many patients and help your patients. And your patients will be impressed that you have gone the extra mile, because it's estimated that over 40 million Americans are either diabetic or pre-diabetic. And that goes like with high blood pressure. I don't know if you have patients like this, but patients that come in my office that have high blood pressure, they put the medicine down, but then they don't mark they have high blood pressure. And I'll say, do you have high blood pressure? They're like, no. And they're like, you're on medicine for it. They said, I know, but it's treated, but they still have it. So you need to explain to these patients and what the medicine's for and what they're doing with it. And you'll start learning all the different types of medicines and talk to your patients. My hygienist already talked to my patients about the medications and what they are. So when I walk in, all that's done. So I could just look at the health history and they go straight to the patient. But there's risk factors linking periodontal disease and Alzheimer's disease. It's common, but it's preventable. Periodontal disease doesn't have to happen. And when it does happen, it can be treated and stay under control because it's known as an initiator for dementia. So oral bacteria from poor dental hygiene has been linked to brain tissue degeneration. So we need to educate our patients and let them know and educate ourselves. The big question is, who do you treat? Like tomorrow when you go into practice, who are you looking at? And you've got to treat everyone. Everyone you look at, you have to think that no matter what their age is, what their gender, you have to look at them and think, I need to evaluate this patient for risk factors and what kind of level is appropriate for this patient. Because every patient is different. Even people with perfect healthy gums. Some of my patients come in and I bet they need their teeth cleaned maybe once a year because they do such an excellent job at home. However, I don't want to say that in case something happens, but I really believe all patients need to be treated the same way and all patients need to have the same opportunity. Oral hygiene instructions, whether the gums look good or not, it might just be fake that they look good. So everyone needs to have good oral hygiene instructions, be introduced to the different products that you offer in your practice. We have different treatment options that we offer in my practice. We have in-office methods that we use and we have the at-home methods. And our patients are very compliant once we talk to them and explain to them and explain why they need that we're just not trying to sell them something, that they really need this and it'll be beneficial for their dental health. Dental health can be managed properly when recall visits are followed. So we want to make sure that these patients are on a certain recall. Our patients do not leave the office until they have their next follow-up visit. And some of our patients are on 2-month recall, 3-month, 4-month, 5, 6 months. It just depends on their situation and where they need help. Home care is a very, optimal, and the success in treating, preventing both period disease and tooth decay requires both. But you have to do the in-office treatments and the monitoring. I do implants in my office. I do a lot of crown and bridge. So when I talk to a patient, how long is this crown good for? What would I guarantee it? If they don't come in for cleanings, then I don't feel like I'm really responsible for it if they're not doing their part. So it just depends a lot. And so we talk to the patients also about keeping that and keeping those areas clean because those are foreign bodies that are being put in their mouth. And the longer duration between a visit results in more dental need and expense because, you say neglect costs money, and it does. And patients need to understand that they don't have insurance, if they don't have money to do this. You need to find the money to do it because neglect becomes very expensive. Co-diagnosing, what is it? It's a communication tool that we as professionals use with our patients. When a patient comes in for an appointment, we want to tell them what we're doing during that appointment. We want them to know what we're doing. We want them to know that this is serious. And so a lot of times what we do as we're going through the appointment, we tell them what we're doing. And I'm guilty of this sometimes, but my team and I are finally on the same page. When you tell a patient, I'm going to probe you, what does a patient think of? They think, oh gosh, we're going to get poked and then there's going to be pain. So they don't want that. And no, we'll do that next time. So you need to stay away from the P words, stay away from those words and just say, you know what, we want to measure. We want to measure the area around your teeth. And they will be more relaxed through that, and you'll be able to accomplish that because they don't want to hear you say, we're going to probe you. And then when you're doing the measurements, what you want to do is tell the patients, when I call out 1, 2, 3, that's good. But when you hear 4, 5, and 6, that's not good. And we're going to need to talk to you about that, what we found, and we're going to go through a diagnosis process with you. So when your hygienist is calling out 1, 2, 3, they can use a soft voice. But when they find a 4, 5, 6, you need to change your tone. You need to put a little bit of urgency in that. And the patients that's sitting there thinking about what they're going to cook for dinner that night, or that Billy's got to go to soccer and Susie's got cheerleading, they're going to go, oh my gosh, they just said a 4 or a 5 or a 6. I've got something going on with my mouth. I need to worry about that. So you're going to change the way they feel, and they're going to be more alert, and they're going to want to feel, and they're going to want to participate, hopefully, in what you're going to recommend for them. So you want to change their experience in your chair. You just don't want to call out the numbers in the same tone and just pretend this is part of the process. You want them to know that this is an important part of what treatment you're describing and prescribing for this patient, and make it a difference in the patient, because then they will feel a part of it and they will usually go along and comply with your treatment. And this is something that we made it up in our practice, and it just helps the flow. Any new patient, and we think of a new patient as anyone that has not been in for a year or more. But we do this with all our new patients, so the other patients have already had it done. All our patients do perio charting, and remember that's perio measuring, and we do intraoral photos on every single patient. We take photos on everything in our office, and we start out, does the patient have calculus? If they don't have calculus, then look at gingivitis. Do they have bleeding, or do they just need a regular prophy? If they have calculus, then we're going to look and see where the calculus is. Is it on the x-rays only? Can you see it? Can you feel it during a exam? Do they have pockets? What are the pocket depth? So you just follow the arrows and you go down, and it just makes life so simple for our team. And it's just something that we do in our office, and I'm happy to share it. It's been very successful in my practice. And that's where I'm at after 27 years. I want to work smarter, not harder. And that's with everything I do, every service I offer. And then we look at it and see where you need to root plane, where you need to put products that we put in at different stages. And the periodontal probing depths, the measuring. We measure every single patient in our office. Especially patients that show calculus on x-rays and upon clinical exam. If we're examining the patients and we feel any calculus, we stop what we're doing. We're going to probe the patient. We're looking at bone loss in the x-rays. And on our x-rays, the digital x-rays, we draw arrows on them. We point so the patient can see, and we label what it is, so the patient knows what's going on in their oral cavity. And they feel connected if you're talking to them instead of at them or above them. They just like that better, and that's how my patients respond. And then we schedule the patient to return for root planing if there's any evidence of bone loss and or periodontal pocking. And then we have charts like this in the room that we show and share with our patients. We also do full mouth debridement of practice. What that is to remove most of the plaque and calculus, so it allows for you to do a complete evaluation by the dentist. Most of you probably know this, some of you may or may not, and hopefully this will help those that don't or aren't familiar, but you got to be careful what you do on that day. You can't do a comprehensive, detailed exam with these codes or you won't get paid. And then you see the patient in 3 months after debridement, because a lot of insurance companies dictate that for 90 days. So sometimes those that you have to go by, you can explain to the patient that you need it sooner than later, and they'd have to pay for it. That's going to be between you and the patient. Scale and root planing, that smooths the surface of the root so that the gums can reattach properly. Cleaning of the root surfaces to remove dental plaque and calculus. You want to get rid of the bacteria that causes gum disease. And, this is only done professionally. Tell the patient, we've got to get down below the gums. We're going to have to numb you up because we've got to get down a little bit deeper, places that you can't reach with floss or a toothbrush. And then heterodox, we use that all the time in our practice. Dentists seem to forget that this is a needed product in everyone's practice. It's a really slow, localized delivery of antimicrobial agents. And it goes subgingival, and it goes into pockets. And the delivery is so easy to do. And this syringe lasts a long time. You can put it in a dapping dish and then express the material into the patient's gums. So it can be used, and what it does is it suppresses the growth of bacteria. So you explain to the patient it's an antibiotic. Patients take antibiotics all the time for infections. This is a chronic infection in your mouth, and it's not healthy. And you need to have an antibiotic put directly into your pockets. So when you called out the pockets, they're going to realize, and they're going to think back to how many 4s, 5, and 6 that the hygienist said, and they're going to be like, yes, give it to me now. So that's what you need to explain to them so they can connect the dots and they're on board. What this is used for, it's in adjunction with scale and root planing. It's not if or, it's you need it with root planing. It's not, you can either have root planing or have this. You want to treat the active sites after root planing, several isolated areas. Sometimes you may root plane just different teeth. You know that you need a certain amount of teeth for the quadrants. Periodontal abscesses, it's great in areas like that. Implants that are failing, smokers that you use. So you need to explain to the patients, and you need to be gentle with them as you're explaining. There's certain verbiage that I've learned in my years, how to talk to patients, how they relate to certain words that you use, how to get them on the same page with you. And then we have periodontal maintenance that we do in our practice, and it's followed by periodontal therapy. It follows root planing, it follows surgery, it follows debridements, and it's different. It's continuous therapy, and it's at different intervals. Some may be at 3 months, some may be at 4 months, 5 months, and it's not preventive, it's therapeutic. Patients really need this. And then the laser that DenMat uses. I don't go without this laser. I'm always using the laser. I do a lot of crown and bridge. So for troughing, I use it. It's less invasive to the tissue, the soft tissue, than putting a retraction cord in. For a gingivoplasty, I use it. For a gingivectomy, I use it. I use it on cold sores. I use it on ulcers. I use it on frenectomies. I see children in my practice. I have patients from 1.5 to, I think my oldest patient now is like, she just celebrated, I think she's 110 years old. And so I use it on everybody, and it's so nice, and it does such a great job. It's painless, it's quick, and the recovery time is quick. And the patients will love you, especially if they have an aphthous ulcer, and it's been killing them for days, and you come in and use this, magic laser on it. So this is a go-to product that I use in my practice every day. Fluoride. We use fluoride on adults. It's not just for children. So you got to look at your patient. We use it in office, and we have fluoride that the patients can take home. So the frequency of how often a patient uses fluoride depends on the risk factor, not on the reimbursement. And sometimes patients have to pay out of pocket. They do in the medical field, and we've got to explain to them that we're healthcare givers and that what we want for your body is just as important. And so you've got to put the patients under a risk level, low, moderate, or high. And determination of the risk level should be based on their age, the number of cavities in the past 3 years, and the presence of other factors. You've got to look at their health history and see what their risk factor is. And there's different types of fluoride, over-the-counter fluoride. You've got to look at the percentage, you've got to look at the age of the patient. And some children that use it, you've got to talk to the parents. The parents have to help them, adults. You need to use it in adults. Like I said before, it's not just for children, it's for adults too, so you've got to explain to them. And a lot of our patients do fluoride in the office, and we send it home with them as well. We sell all these products in our practice. We use all these products. We use the trays, and we just have found that this is what patients need, and it helps our patients that are at high risk to become low risk patients. And the role of home care, we've got to explain to them what we expect and what they need to expect with it. If they keep coming in with decay or having to redo crowns, maybe they're not doing a good job at home. So we need to explain, patients with gingivitis, or periodontitis, they often struggle between appointments. They're not flossing. They might floss for like a couple days after, and then they forget about it. Insufficient home care causes them to lose their teeth and suffer from other related systemic disease. Because I said before, heart disease, diabetes, cancer, all that's related to gum disease. And so periodontal trays are great ways to help the patients at home. And so when you use in-office treatments as root planing, perio treatment, and these trays, it really does actively fight bacteria buildup and prevent bacteria from spreading daily. Home care, these are products that I use in my practice. We offer the water flosser. We don't mark it up. We offer the floss sweaters, the interdental brushes. We offer the ProDent. It's a chlorhexidine rinse. And the patient takes it home and they rinse with it once or twice a day. We give them instructions per their risk. And the patient uses it, and you can tell when the patient uses it or not. You know, this is like my go-to in my practice. I'm very passionate about using peroxide therapy for periodontal disease in my practice. As a matter of fact, I'm so passionate about it. I mean, I feel like every patient should use this. I don't have any perio problems, but I have these trays and I use them every day. I feel like I've just had my teeth cleaned and then I brush with it. Because what we've seen with hydrogen peroxide is it has been shown to increase oxygen to tissue that is diseased. And it increases the bioactivity, the growth of healthy tissue, so that you can regenerate the tissue and make it healthy again and get rid of all the anaerobic bacteria. The healing process is enhanced with the increase of oxygenated blood, because that is the enemy to anaerobic bacteria, oxygen. Exposure to oxygen improves vascularization, the strength of tissue, and the healing occurs quicker. And so you've got to look at the mechanism of action. What it does is it's delivered, and in the sulcus, it releases oxygen, so it changes the environment in the pocket. So it makes it harder for the anaerobic bacteria to survive. Because other than that, it just grows in there and just grows, and that's where your pockets get deeper and deeper. And if you remember that slide, that laminated slide I had in one of the slides, I showed that to the patient and talked to them about exposing your pockets to hydrogen peroxide. And you can't rinse with it because it doesn't stay attached to the tissue. The gel, it's got to be in a gel form that can break down cell walls within a typical dental biofilm. And it needs to be exposed, like a 10-minute exposure to 1.7% hydrogen peroxide. And it breaks down and it loosens the dental plaque and calculus. It improves their overall gingival health. So patients that have heavy calculus, they may not have just heavy calculus on the mandibular. They need a mandibular tray. Number one, it's going to improve when they come in. It's going to be easier to clean it. It's going to be less painful for the patient. The patient's not going to worry so much about, oh gosh, I hate when I go in there when they have to scale those bottom teeth because it hurts. It's going to be easier for your hygienist. We don't want to tell our patients that's one reason, but that is a good reason because it helps it remove quicker and easier. When holding the peroxide in place with the mouth guard or tray allows deeper penetration into the pockets. And that's the reason that you can't use bleaching trays, because the bleaching trays don't go down that low. They're not made to go into the pockets. What are the goals of periodontal therapy? The key goal of periodontal treatment is the removal of pathogenic bacteria, correction of reversible risk factors, and prevention of recolonization of bacteria. So we want to create a resolution of the inflammatory process. We want to stabilize. We want to gain attachment levels. We want to reduce the pocket depth when we measure. We want to reduce the pathogens that are in the mouth, the bad pathogens. We want to do a whole modification, behavior modification. We want compliance with our patients. And with Perio Restore, it's so easy to use. The trays are easy, they're comfortable, and you set a plan, and the verbiage we use gets the patients on board. And they do this for us, and they help us, our work, and we help them, and we're treating them, especially patients that have a lot of money invested. The Perio Restore system is designed to deliver periodontal therapy deep into the pockets. And you've got to have a custom tray for the patient. Patients always say, why can't I use my bleaching? Because they're not made for this delivery. Why can't I just use my night guard? It's not made for the delivery that we want. We want the gel to be pushed down into the pockets. And that's what these trays do. And we use it in conjunction with scaling and root planing. And it's effective at treating periodontal disease at any stage. I've seen the results in my practice. I see it every day. That's why I'm such a firm believer in this. I've seen the reductions of perio pockets. I've seen an unhealthy mouth become healthy by using these trays. It does fight the bacteria, and it keeps the bacteria from recolonizing and preventing further infection. Because one tooth has it, it's going to go to another tooth. And the daily use of Perio Restore is extremely effective in controlling and treating periodontal disease in conjunction with in-office cleanings. And it doesn't replace root planing, it just adds to it. So you've got to remind your patients of that and your team. My colleagues say, well, why can't we just use hydrogen peroxide? Well, guess what? That's great, but it doesn't allow the materials to go into the pockets. So the patient's not really getting any benefits from using that. And it's not, because it just simply flushes away and it doesn't have enough time to stay in contact with the tissue. And so that's why the gel is such a great thing. And that's why, I mean, I really believe every practice should have this service. You have a menu of services. I think this should be a service that you offer in your practice. Hydrogen peroxide has not been shown to be effective in treating the presence of biofilm, but 1.7 has. But 3% hydrogen peroxide is not designed for daily use, because it could, if you ingest it in large quantities, it can be poisonous. And the hydrogen peroxide, the Perio Restore, not only gets the gel in the pockets, but it also increases the tissue, it makes it healthy, and you can tell the patients too, it gives them fresh breath, and it also whitens your teeth. Whitening gel takes too long to break down, so we can't do that. And plus the whitening gel, the trays, we don't want it on the tissue. And this tray, Perio Restore, I've used the other Perio gel, but the Perio Restore, it does customized patient trays. You have this cool patient tray caddy that I love, and the Perio Restore gel. It's 1.7 hydroperoxide. It comes like in a mini taste. So if patients use this, they want to use it. It makes your mouth feel so clean. I hope all of you order a set of trays for yourself. And then I've ordered it for myself. All my team has it, so we can explain. This is how I do everything in my practice. I do it usually on myself or my team members if they need it, okay? Because I do Botox and filler, they all want that. So I try to have everybody do what we use in our practice, because you got to practice what you preach. In Perio Restore Oral Cleansing Gel, the active ingredient is 1.7 hydrogen peroxide. We use it with custom-made trays. When used as directed, it can kill more than 90% of bacteria in a series of 10 to 15 minutes. And you'll decide which way you want your patients to go. Some of my patients use it once a day for 10 minutes. Some use it once a day for 15. Some use it twice a day for 15. Some use it 3 times a day. It depends on what risk factor they're at. And bacteria do not become resistant to hydrogen peroxide like they can with other antibiotics. So it's good to use hydrogen peroxide. There's no buildup or immune system. And each tube will last about 45 full mouth treatments. They're digitally designed custom trays that include interproximal reservoirs to hold the gel in place. And so what you do is you have your patients put a full dot of the gel into each reservoir, then they seat the tray. The gel will flow into the infected pockets, and custom fitted trays are designed to apply pressure to hold the gel in place to ensure great treatment. So if you just use a regular tray, there's no pressure to hold the gel in place. So the gel just comes out, and then you have a mess in the patient's mouth, and they're not getting the benefits of it, and they're just really wasting their time doing this and their money. That's why you need to do it, and they need to be customized. And you explain to the patients, they're going to wear their trays for 10, 15 minutes, rinse their mouth, or brush and floss their teeth after. What I do personally is I use the trays, and then I brush my teeth with it. And then I just spit out the remainder. And what I've learned to do, and what I try to encourage my patients, is when they use the trays, whether they're using it 1 time a day, twice, 3 times, like I said, it depends on their level of treatment needed, and you'll decide that. And the trays need to be worn for a minimum of 10 minutes to get the effective clinical benefits of the home care. And the gel needs this time to break down the peroxide into water and oxygen. And the patient needs to bring their trays for each center appointment, and the patient needs to use cool water, because you don't want to deform the trays with hot water. And if you look at the difference between Perio Restore and the competitors and bleaching trays, they're designed to hold the gel in place and extend above the gingival margin for treatment below the gum line and approximately for 4 to 6 millimeters. Where the competitor, the fabricated using traditional model pouring method, we use the monophase with the Perio Restore. It's easy, you can scan them. I mean, it's so easy to do. So it's a great way to do this, and it's designed with the raised seal the competitor is, which is above the gingival margin 4 to 6. And bleaching trays are thinner material, and they are not designed to do this and to hold the gel. And with the gel that Perio Restore uses, there's 1.7 hydroperoxide gel, which features easy flow into the custom trays for optimal penetration. And there's a pleasant flavor too for better patient compliance. You want it to taste good for the patient. And then the competitor uses 1.7 hydrogen peroxide mint flavored gel for use with custom tray. And then the bleaching is usually used with carbamide peroxide, and the gel is just higher concentration, so you don't want this to touch the tissue. And the patient kit on Periodontal, it just makes it handy. I travel a lot, so it's easy for me to keep it. It's easy to put your trays up. You don't want to put your trays into a little kit and have them mildew and smell and everything else. You want to be able to put them somewhere, let them clean and dry out, whereas the competitor doesn't do that. You can get a tray, but it's for additional cost, where Periodontal is all in one. And the bleaching is designed for tooth whitening, not periodontal treatment. The delivery can vary, but it's typically 15 minutes with Periodontal twice a day, where the competitor can vary. Bleaching trays is usually overnight or a minimum of 4 hours. Like I said before, Periodontal uses simple monophase material. There's no charge for impression adjustments. The impressions are scanned and they're kept on file for 3 years. And what you get back with these trays, one thing why it made me change too is because the trays come back on a model. So it's easy to show the patients what they look like, where they are. The patients can keep the models and they're scanned. So they're kept. So if the patient loses it in a hotel, if it gets a dog, chews it up, you don't have to take a new impression or scan them. You just call DenMat and you get a new tray. And the trays come within 7 business days because they have dedicated lab customer support. Our competitor is complicated. You have to do like a heavy wash and a light wash. It's just a dual technique. And if you want impression adjustments, there's additional charge for it. They've got to pour the models up. So they're going to be you have to use alginate. There's no scanning of the models, and it can take up to 2 to 3 weeks to get your models back. People today want it now. If you tell them they need Periodontal, they want it tomorrow. And so with DenMat, they get it back in 7 days or less, and they give you great lab support too. And you put the lab slips in, you're noting the conics, the implants, you give them a current perio chart, and a lot of times insurance will want that too, and you send it in serialized impressions. And how are you going to communicate this to your patients? The role of the dentist are changing, so you want the dentist's role to be over their overall health care. You want them to know you are looking at them as a perio, that you're not just a drill, fill, bill doctor. You want to look at their health history. You want to know what the oral cavity looks like. So you want to make sure that you add this to your services, because we can be the first line of defense, because your oral cavity is the window to your health. And you need to look at periodontal disease. Is it gingivitis? Is it periodontitis? Is it severe? So you need to know what you're looking at. And you need to educate, you need to explain, and you need to encourage your patients to take this treatment and do it at home and in your office. If you suggest something, you want to get all your patients on board. You need to know that they need to protect the investment in oral cavity. That's why oral photos are so important. I tell the patients, look how much money you put in your mouth. This is a good way to keep up with it, to take care of it. This is insurance for your mouth, especially as we get older, our decay goes lateral. And what I tell my patients, what I do is in the morning, if I take my shower in the morning, I go ahead and put my trays in. And I'm going to get a little personal here. I put the trays in, get the shower, and then I set my cell phone for 10 to 15 minutes. And then my alarm goes off and I'm finished for the day. And then I rinse it out and I've done it. It's just easy to do it. And the trays are comfortable, so there's high compliance rate. It's a disease that needs to be treated, so I make sure my patients know that. And it's easy to do it. I give them suggestions. They can do it while they're reading the newspaper, while they're checking their email, while they're walking their dog. And how does it benefit the patient? It whitens their teeth, it cleans their breath, it removes bacteria. That's how it benefits the patient. That's why I believe every patient should be doing this. And will patients comply? My patients comply. I talk to my patients all the time. You set your cell phone for the time, jump in the shower, check your email while you're watching TV. And for insurance, right now, some insurance companies are recognizing this and some are not. But I can give you verbiage for the patients to send to their insurance, for you to send. Sometimes with patients that have cancer or patients that have heart disease, sometimes you can talk the insurance company into paying for this. So it's worth a try to do it. A good write-up, documented history is a great thing to do to put in for the patient, for the lab to cover us. Will insurance pay? You got to provide a diagnosis, the probing measurements, their health history, their bleeding points. So it's worth the try to get it, but you've got to tell the patient sometimes it'll pay, sometimes it won't. But it's worth insurance in their mouth. And you document per arch, and it's effective treatment, and you can send in a pre-estimate. But once I tell the patients, you've got to think a little bit outside the box, and you got to think all the money you invested in. What I do with my patients, and this is just, and patients accept it. If I do an implant, if I place an implant, If I'm going to do bridge work, if I'm going to do more than 2 or 3 crowns, if I'm going to do a full mouth restorations in the mouth, I put on the treatment plan Perio Restore trays. It's on there. They have to accept the treatment for it. And that's just what I do. I think outside the box for my entire practice. And this can give you a chance today to add a new option to your menu of services. It's a great way to help your patients. It's a great way to add productivity to your practice. It's a great way to give bonuses for your hygienists. Get everyone on board, and you can change the way you think today about what services you can offer as a dentist, and you can take your practice to the next level.